Patient MA is a 30-year-old female, 5 foot 4 inches, 55 kilograms, who presents to the emergency department with pain and swelling in her right leg after finishing up a weekend road trip. She also has some increased shortness of breath, but otherwise is stable. Duplex ultrasonography shows a distal deep vein thrombosis, DVT, in the patient's right leg, and CT pulmonary angiography shows presence of a pulmonary embolism, PE. The resident physician wishes to initiate enoxaparin therapy, as they will be admitted to the medicine ward. So the key thing to look at here is enoxaparin. You know that's going to be a question on that drug. You'd go straight to the question here. Just skip all the medicines and the labs right now. So they want to know what's the correct enoxaparin dose for this patient. So whenever they ask about enoxaparin, the thing you want to know first, if they're either treating or if they're using prophylaxis for DVT and PE. So if you read here, so they already had the lab, the imaging that shows that there was already a confirmed DVT. And their CT also shows confirmed PE, but either one, it doesn't matter, it's the same thing. So we got treatment of DVT or PE, it's the same exact dose. So next thing you want to know is if you need to renally dose adjust it or not. Right, so you need to calculate the creatinine clearance for this. You need to know, because the cutoff here is creatinine clearance less than 30, or if it's creatinine clearance greater than 30. That's what you want to know to do this question. So you have to calculate the creatinine clearance formula for this. So that equals 140 minus age times it by weight, all divided by serum creatinine times 72. And remember, in the Naplex, the patient is always going to be female because they know they're going to trick you with that. So make sure you always remember to multiply by 0.85 for being female. Always female in the question because they know somebody's going to mess it up. So when you do this, you just fill in the formula. So 140 minus age is 30 years old, times it by weight. So on the actual Naplex, they're going to tell you which weight to use, whether that be ideal body weight or actual body weight. But since they don't tell us in this question, I'm just going to use actual body weight, all divided by the serum creatinine. So you have to find the lab here. So in the labs here, they say serum creatinine is 0.8. So that's what I'm going to enter for the serum creatinine. Times it by 72. And always remember, the patient's female, so times it by 0.85. So when you solve for that, you should get 89.2795139. So the only thing important of this is that this is greater than 30. So we know that's greater than 30. So now you look all the answer choices here. They're all something, the frequency is daily. All the frequencies daily in all the answer choices. So the enoxaparin dose for creatinine clearance greater than 30, which we just calculated was 89. So that's why we're using this. The enoxaparin dose is either 1 milligram per kilogram sub-Q every 12 hours, or it is 1.5 milligrams per kilogram sub-Q daily. Right? Could be either one of those two. But you saw in the answer choices, they're all daily, right? So you could just skip this one because it's not a Q20 12-hour dose. You have to give a daily dose because the answer choice is all daily. So when you solve for this, 1.5 milligrams per kilogram, you just multiply this by 55. The body weight's 55. And luckily for you, they already have it in kilograms. So 55 times it by 1.5, that equals 82.5 milligrams. So you're always going to get like most likely you can get some weird number. Just like in real life, you won't get the exact number. So you just round it to the nearest, whether that be round up or round down to the nearest, like whatever we have in stock. In this case, it's 80 milligrams of enoxaparin. And the graduation lines, they're like not very small enough. So that's why you tend to round it up. Otherwise, it's difficult for the nurse to administer exactly 80 milligrams of enoxaparin. So that's why the answer choice here is A, 80 milligrams sub-Q daily. Enoxaparin also comes in these strengths, 60, 40, and 30. And they don't come in between those, like 65, 64, 63. They tend to be in these increments. So that's why you won't get an exact number that matches what you have available in stock. So that's it with the question. So you can stop the video here. I'm just going to explain what these other answer choices are in case they trick you. So 60 milligrams per kilogram sub-Q daily. That's 1 milligram per kilogram daily if your creatinine clearance was less than 30. That's why they're trying to trick you here if you calculate this serum creatinine clearance wrong. And then this 40 milligrams sub-Q daily, that is actually prophylaxis for DVT or PE if your creatinine clearance were greater than 30. And this answer choice, 30 milligrams sub-Q daily, this is the prophylaxis for creatinine clearance less than 30 for DVT or PE. So that's it. If you have any questions, please leave it in the comments.